We are closer than ever before to the reform that the American people need, and we're going to get the job done.
So, Mr. President, it's time to scrap this bill. Let's start over in a bipartisan way. Now, there are some members on the Democrat side that got both arms broken during the cap and trade fight on the floor. Now there are no more arms to break. That's why they're having problems.
Well, there you see the president in a Rose Garden ceremony, another event, the 9th event in as many days, pushing health care reform. You would think there that it was between the president and Republicans that's holding this up, but actually it's blue dog Democrats, conservative Democrats. Take a listen.
I think we need to slow things down. I think this is a very important issue that we need to tackle. I've got a lot of folks in my district who are uninsured, so I think what we need to do is take our time on this. If it means going into the fall, it means going into the fall. Before we consider any kind of new revenue, they want us to squeeze every ounce of savings that we can out of the current system. That's what we're demanding.
The House Energy and Commerce Committee scrapped a markup session today and has scrapped it tomorrow. Where are we with health care reform? Is the president's plan in trouble? Let's bring in our panel. Steve Hayes, senior writer for the Weekly Standard, Mara Liasson, national political correspondent of National Public Radio, and syndicated columnist Charles Krauthammer. Mara, let's start with you.
Well, we're down to the wire, and we're running out of time, and the House has 2 more weeks, and the Senate has 3 more weeks, and they got a lot of work to do if they're going to meet the president's original deadline, which was that each House should have a bill done by the August recess.
Although he has since said that it could slip.
He has since said it could slip. He doesn't say August anymore. Now he says we want it by the end of the year, the whole thing. Originally he said October. The problem is that this is a war inside the president's own party, and already the Speaker of the House and the President have been trying to make amends, or at least make some offerings to these conservative Democrats. In the House, they're the Blue Dogs. In the Senate, they're people like Ben Nelson and Mary Landrieu. And what he said is he wants this IMAC commission. This is something that's very important to the Blue Dogs. An independent commission that would take away from Congress the power to set Medicare reimbursement rates. It became a form of pork. And it would be an independent panel, and that they would do that. That doesn't solve the problem of paying for the plan and making it deficit neutral, but it does. This IMAC commission would bring costs down. Now, the problem on the paying for it side is that the House presented a way to pay for it. Raise taxes on people making over $280,000. A lot of Democrats freaked out at that, and now the Speaker, Nancy Pelosi, is saying, okay, we'll just raise taxes on 1 million people, on people who make $1 million, millionaires. That sounds a lot better. Okay, if you do that, then where are you going to get the rest of the money? So they're really struggling with this.
Steve?
Well, and then the amazing thing about Nancy Pelosi's argument on raising taxes just on millionaires is that it was an entirely political argument. I mean, she was very naked about how she put it.
Yeah,
she said, look, I can sell this better. This sounds better. People down the street don't know people who make $1 million, but they might know people who make $280,000. It was an incredibly political argument, which goes back to the point I was going to make about the president. You know, President Obama said the other day, this is not about politics. But it really is all about politics, and as you pointed out in the introduction, his problem is with his own party, and yet the White House has spent the last 2 days attacking Republicans and attacking Republican strategists. I'm bewildered by the White House strategy on this at this point. It makes 0 sense to attack Republicans when Democrats are the ones who he's having these problems with.
At the same time, the Democratic National Committee is running ads against some of these moderate Democrats in their states. Charles?
Look, it is about politics, but it's mostly, despite what Obama also said yesterday, it's about him. It's entirely about him. It's not about cost control, because all of the plans are going to raise the cost. It's not about quality, improving quality. If anything, these machinations are going to decrease the quality of American health care. And it surely isn't about efficiency, the inefficiency that I've accrued in the healthcare system as it developed over the decades, because it's going to introduce all kinds of new commissions, new regulations, all kinds of inefficiencies. It's about Obama. This is his signature achievement he's promised. If he doesn't have it, if he doesn't have a bill, any bill, at the end of the year, his presidency is going to be seriously damaged, and all the mystique will disappear.
Sounds like you're saying it's his Waterloo.
Well, but therefore, it's not going to be a Waterloo. Therefore, I'm absolutely sure that at the end of the year, he's going to have a bill. It'll have the word health care reform on it. It will be extremely watered down. All of the ballast that the Blue Dogs are protesting against, including, I'm sure, the public plan is going to be thrown overboard, and it'll be a very weak version of what we have now, probably even harmless, which will be a great American achievement. But he's going to have something. He's not going to have it in August, but he'll have to have it at the end of the year. Democrats understand his presidency is over if he gets nothing.
If that's the case, Mara, and it's much watered down, how tough is that for the left to handle with a president that has a Democratic Congress, House and Senate, and started off with approval ratings in the high 60s?
I think on this one, the left is just fated to have their hearts broken. And they're going to, and the president will tell them all the things they got instead of single payer or a Medicare-style public option. They got universal coverage rolled out over time. They got everybody can keep their health plans. They're not going to be denied because of a pre-existing condition. There's going to be lots of things to mollify the left wing of the Democratic Party if he gets this. There's a lot of struggle.
A lot of road to get there.
A lot of road to go. I think that's the least of his problems right now. I mean, he is negotiating. One thing that everybody said is the president had to get more involved. He is. He's had the Blue Dogs up. He's signaled to the Senate that he's open to all sorts of different formulations of the public option, including ones that are not so robust. And I think in the end, they probably will get something. The danger is if they don't get it by August, you have a whole month for the opponents of health care to go out there and shoot at what they think is going to be in the bill. They need something specific.
By millions of dollars in ads. The House Majority Whip, Jim Clyburn, just told our producer on Capitol Hill, if we can do it next week without consensus or wait a week and do it with consensus, I'd rather wait a week. So they seem resigned that it's not going to happen up until the August recess.
Well, maybe they'll stay in. He said wait another week.
Yeah.
Well, this is part of their problem. I mean, I think this is not an original point necessarily. We've been talking about this actually on this panel for weeks. The problem with, I think, his plan, the health care plan, like the stimulus, was that if he doesn't rush it through, the more people see it, the less they like it. You've now got a new Politico poll that was out today about the public and the public plan, the views on the public plan. It's like 73% of Americans think that it won't lower costs. I mean, that's one of the fundamental tenets of his plan, and people think he's not going to deliver. That's a huge problem.
We'll hear more from the president, of course, on health care and other issues during his primetime news conference Wednesday night, 8 p.m. Eastern.